We're gonna go over why you keep on dislocating your kneecap. And it's probably because you probably didn't know that you might have injured a ligament here that attaches to your kneecap. Dr. Marco Lopez, Doctor of Physical Therapy and Certified Strength and Conditioning Specialist, and co-founder of the Basketball Doctors. Our goal with the Basketball Doctors is to provide evidence-based information regarding all things rehab, injury prevention, and performance for basketball. This is all for just educational purposes, not medical advice. If you need medical advice, send us an email. Hopefully we can help you if you're around the area in Los Angeles or Orange County, or virtually, or visit your local physical therapist or physician. So let's jump into our topic about recurrent kneecap dislocations. So this is one of the most common questions we get asked is, why does my kneecap keep on dislocating? So let's kind of break it down. So first, let's talk about what the structures are involved when you dislocate your kneecap. So whenever you dislocate your kneecap, it's different from dislocating your knee, because when you dislocate your knee, you dislocate the tibiofemoral joint. When you dislocate your kneecap, you're dislocating that patellofemoral joint, which is that joint between this bone, the femur, and that kneecap. And usually when you dislocate your kneecap, the kneecap goes out to the outside, laterally. And usually it happens when your knee's bent and it rotates. We have a rotation where one part of your leg goes one way, other part of your leg goes the other way, and the kneecap goes out to the side. What we noticed is when that kneecap goes out to the side, if this ever happened to you, your knee's bent, and then when you straighten out your knee, it pops back in place. Might feel weird, might give you some issues, but the biggest thing is once you dislocate your kneecap, we gotta figure out what caused that dislocation. Also, did you injure that ligament? Sometimes a dislocation is a result from this repetitive microtrauma that you kind of dislocate your kneecap all the time, so it might be a recurrent one. If it's your first time, it may be because of that positioning, or it could be, studies have shown some weakness in the quad that didn't provide good stability when you turn, weakness in the glute, too much IT band tightness, and that causes that rotation. And usually the dislocations, like I mentioned, guys, it's gonna happen with your knee bent. And the most important reason why the kneecap doesn't dislocate every time you turn, you bend, or anything is because we have a ligament here, the medial patellofemoral ligament. So to kind of reorient yourself with the kneecap has stability everywhere. So here in this patellofemoral joint, there's a groove in here where the kneecap kind of slides in. We also have stability from the quadriceps tendon and the patellar tendon to keep that attached vertically. Horizontally, we have the IT band. We have the vasti muscles here. We also have in the inside that medial patellofemoral ligament. So sometimes the old kind of common thought is whenever you dislocate your kneecap and you keep on dislocating it, it's because the IT band's too tight. And when the IT band's too tight, it keeps pulling the kneecap out to the side. And they use that IT band release technique. However, we noticed that IT band release technique, where they kind of chip off some of the IT band, it contributes to even more instability. That's because we now discovered, or they kind of started checking out more, that medial patellofemoral ligament. Now, whenever you injure this ligament, if you keep on dislocating your kneecap, you might cause more trauma in this ligament, and that's the medial patellofemoral ligament. And if it's torn, your kneecap now is going to have a tendency to go more out to the side. Let's talk about the medial patellofemoral ligament. This ligament connects the kneecap, the medial part of the patellofemoral joint, to the medial part of the knee. What happens though, guys, whenever it goes out to the side, it really stretches it out. So you might have a sprain or a tear. That's why you might have those recurrent dislocations. That medial patellofemoral ligament is the most taut, the strongest when the knee's straight. When you start bending it more and more, then that's when it gets a little bit more loose. And that's why around that 30-degree knee bend is where we have the most injuries occur. And that is one of the reasons why you have that recurrent dislocation. It's not because your quads are not strong enough. It's because sometimes you might have torn that ligament, and that provides that medial stability, and that might cause that recurrent dislocations. So if you dislocated multiple times and you strengthen your muscles, you worked on some movement with your physical therapist, working on your quads, glutes, hamstrings, if that all fails, then we would recommend seeing if you injured that medial patellofemoral ligament, because that ligament helps provide stability to that kneecap, and that's why your kneecap might be going out to the side. Hopefully you understood that concept. We'll kind of break it down again, a quick summary, but your reason why your kneecap might be dislocating all the time out to the side is because you might have injured that medial patellofemoral ligament. If you injured it and you worked on all the muscles, the quads, the hamstrings, the glutes, worked on some movement, and it still has that recurrent dislocations, patella instability, then we would recommend that medial patellofemoral reconstruction surgery. Hopefully you enjoyed this video. Hit the like button, subscribe button, share this with friends and family. And if you guys have any other questions, comment below in the chat. We'll try to make more videos on this. But we are the basketball doctors, so let's ball for life.